Hi, I'm Lucas. I'll be presenting on ADHD. ADHD, or attention deficit hyperactivity disorder, is a neurological disorder causes inattention, lack of focus, and impulsivity. You might know it as ADD, or attention deficit disorder, but this name is outdated because it only describes one type of ADHD. It's one of the most common mental disorders. Someone you know or are friends with probably has it. So, how is it diagnosed? Well, a diagnosis of ADHD is based off of symptoms occurring over a period of time in more than one setting. For example, symptoms can be present at home but not at school. To receive a diagnosis, a person has to be exhibiting 6 symptoms of the type of ADHD of a certain type of ADHD, um, or only 5 if the person is 17 or older. There are 3 types of ADHD, and the type someone is diagnosed with is based off of the symptoms that they exhibit. The 3 types are primarily inattentive, primarily hyperactive, and combined presentation. Combined presentation is a little bit more complicated to diagnose, but I'll get into that later. So, primarily inattentive ADHD. What is it? Well, it's what it sounds like. Someone with primarily inattentive ADHD is mainly going to be having problems focusing, staying on task, and organizing. Symptoms of this type include avoidance or dislike of tasks that take sustained mental effort, being easily distracted, problems with time management, and problems completing tasks. The next type would be primarily hyperactive, which is, again, what it sounds like. People with this type mainly struggle with hyperactivity or just constant movement. Symptoms of this type include difficulty staying still in their seat, excessive movement or fidgeting, or not being able to wait their turn to speak or cutting into conversations, that sort of thing. The third type is combined presentation, which, once again, is what it sounds like. People with combined presentation show they have symptoms for both of the other 2 types present. So, as I mentioned at the start, diagnosis for combined presentation is much more thorough than the other 2 types. It involves a psychiatric evaluation, complete family and medical history, questionnaires, extensive questions about the person's childhood, education, the environment they grew up in. And the reason why this process is so extensive is because other neurological disorders can easily be mistaken for ADHD, such as mood disorders, learning disorders, substance use, and other medications. Additionally, people who have ADHD might also have one of these other disorders that can mimic it. So doctors just have to be very careful diagnosing to make sure that they know what the person has. So, what is the cause of ADHD? Well, the exact cause is not known, but evidence does suggest that it's genetic, as well as there are some biological differences that are seen between people with ADHD and people who do not, such as children with ADHD have less gray and white brain matter. Other factors that have been linked are stress during pregnancy, exposure to substances, and low birth weight. So, how is this disorder treated? Treatments are therapy and medical intervention. The most common kind of medication is stimulants, which increase dopamine levels in the brain. The um, the two stimulants are methylphenidate and amphetamine, which are used in active ingredients in medications. Adderall, Ritalin, and Focalin are short-acting medications, and they last about 3 to 4 hours, while Concerta and Adderall XR, which is just a different form of Adderall, are longer lasting, around 8 to 12 hours. And this is really good for students or children who are trying to get through a school day. It's very helpful for them. Not all medications are stimulants. Some children don't react well to stimulants. So um, there are two chemicals that are used in non-stimulant medications, which are clonidine and guanfacine. Um, and what these medications do are they lower high blood pressure. These medications are very short acting and typically require a couple doses a day. So, um, what is the prevalence of this disease? Well, according to CHAD, which stands for Children and Adults with Attention Deficit and Hyperactivity Disorder, in 2022, about 3.5% of the population has ADHD. Doesn't sound like a lot, but what that comes out to is about 11.5 million people with ADHD in 2022. So, to summarize, ADHD is a complicated neurological disorder that people often misunderstand or have just an incomplete or outdated picture of. It can be difficult to diagnose because it can be very similar or appear alongside other mental disorders. You probably know people with this disorder, or at least are acquainted with them, and understanding it is crucial to understanding those people and having good relationships with them.